promoting businesses and organizations to help them reach their full potential, lighting the path to the success of your business, enhancing the lives of our listeners by talking about things that matters most, helping you to shine your light emotionally, mentally, spiritually, socially, and physically, spreading positive vibes. You've got it locked, and you're listening to Light Vibrations, brought to you by Light Communications right here on CBN Radio 90.9 FM. And now your host and our director, Natasha Letson.
Hello, you've got it locked and you're listening to Light Vibrations powered by CBN Radio 90.9 FM and brought to you by Light Communications. I'm your host, Director of Light Communications, Natasha Letson. Today our program is being sponsored by the Ministry of Health and Social Development, and our guest is Miss Ivy George, focal point for NCDs, who will share some information about the CHIP program. Welcome, Miss George.
Thank you for having me, Miss Letson.
Always a pleasure. Miss George, start us off. What exactly is CHIP?
CHIP stands for Complete Health Improvement Program. It's a lifestyle behavior change program that is run in the community, and it's geared towards helping to prevent, control, and reverse chronic non-communicable disease and their risk factors.
Mm-hmm. And we know the risk factors that you talk about a lot. What are some of these risk factors?
The risk factors are unhealthy diet, a diet that is rich in highly processed food and not enough vegetables and fruits, also grains and legumes. Also, it's over not enough physical activity. It's required for adults at least 30 minutes per day, and smoking and harmful use of alcohol. Those are the 4 behavioral risk factors, and if these risk factors are not controlled, then they give rise to high blood pressure, diabetes, high cholesterol, and then these then lead on to complications and diseases such as heart disease, strokes, heart attacks, and kidney failure and amputation, etc.
Mm-hmm. Now, how did the Ministry of Health learn about this program?
Well, many years ago, when this program was first originally geared toward just heart disease, I found it on internet in my research for just doing research on diseases, on health in general, and then I thought it was an interesting program. But at that time, I thought we needed something, diabetes and high blood pressure was seen more as the 2 important thing. And at that time too, in terms of it was sort of just coming on the stream when I found out about it. So you want to make sure that if you're going to recommend something for a population-based program, that it is well researched, it is scientifically based, and it is well documented and given good reviews. So the next time when I heard about it was when I was looking for a community-based program to complement what we were doing in the ministry in terms of the other kinds of programs. For example, the school-based program, you were looking at some policies, etc. I came across it again, and then I contact the agency, the Lifestyle Medicine Institute, and start to develop a conversation in terms about what would be the what all we will need to do to be able to implement such a program here.
And we noticed some time back as well, you had Dr. DL come to the territory. Tell us a little bit about that visit and how instrumental it was with bringing the program to this stage.
Well, Dr. DL is the founder of CHIP, and while he's retired, when I was in negotiation with the persons who I was dealing with at Lifestyle Medicine, one of the things I requested is the possibility of Dr. DL coming to the territory to help us in terms of the promotion as to why this is a good program. And so he came and did quite a number of activities, meeting with the minister, meet at community-based people, faith-based person. We look at some partners, etc. And I think his visit was well received.
Awesome. Now this CHIP program, like you said, you've been, it's been on your radar for a lot of years now. Why is it so important to the Ministry of Health?
Well, like I said, one of our main problem is non-communicable diseases. And our numbers are high, and we need to really have a reduction in the prevalence of these diseases in our community. And two, the fact that there are certain things that only people can do. And in terms of lifestyle changes, the individual have to become very intentional about wanting to adapt a healthy lifestyle. And what this program is an excellent program for that. It's 10 weeks, 10 to 12 weeks. It's very comprehensive. It's like a whole of health approach. So it looks at activities in your physical, your spiritual, and your emotional and mental. So it's rounded. It's a program that it is presented by expert in lifestyle medicine, and our people just facilitate it. So you'll get all the people who participate will get the same content delivered in the same way. And so we are looking forward to using this program to help us to get more people empowered about becoming concerned about changing their lifestyle, improving their health, and the fact that it is well established that these diseases and their risk factors are preventable, and they're preventable. And if you do come down with a disease, it is controllable. And there is now a whole lot of literature that is now pointing to the fact that these chronic diseases are also reversible. So therefore, there's no reason why we should have such high prevalence in the population, and why the government and the people in the Virgin Islands should have to spend so much money on medication, surgery, or other complication from something that is now well established as being preventable.
Well, awesome, Mr. George. You spoke about the program being, using an all-of-health approach, and how exactly, if you could share, some of the elements in terms of, your physical, your spiritual health, how does the program seek to lower our vulnerabilities or seek to help us to control these chronic diseases using that platform?
Okay. Well, for example, in the program, you will learn about these diseases, high blood pressure, cancer, diabetes, heart disease. And this program uses an all-of-health approach, and so there's information that will be presented on the disease. the information that will be presented on the risk on things like nutrition, physical activity, stress. It will also touch on information in terms of your environment, how it's important to be you're using certain products and how they will probably have an effect on your health. It will talk about unforgiveness, and that how unforgiveness is now being something that the research is showing that is linked to some of these chronic diseases, and like I said, your whole mental well-being, etc. So it's not just about what you eat, just doing the physical activities and maybe learn about the disease, but it connects all to show you how that we are an interconnected being, and how all of these areas work together to improve and help us to stay healthy.
That sounds really interesting, Ms. George, and I like how, it touches on real life, the things that we are probably doing that's creating diseases within our bodies that we may not know about, and talking about, different things that we could look out for to keep us safe and give us basically a roadmap of how to do so even before you get a chronic disease.
Yes, and that's a whole important. While this program do focus on the people with disease, it also focus on people who don't have the disease. And I really want to stress that it is always better to prevent. And I'm saying, so since we now know that these diseases and their risk factors are preventable, we really want to try to encourage persons. And the earlier you start, the better.
So, Ms. George, tell us how the Ministry of Health will be implementing the CHIP program.
It's, as I mentioned earlier, it's a community-based program. And we will like to roll it out in communities where people will meet together in a group, or we are also looking at online. Since the new COVID situation, the lifestyle medicine has really been pushing the concept of increasing the more people doing it online. So we are going to try to offer some community-based classes as well as maybe a class online. So what will happen is that last year we trained 22 facilitators, and so the facilitators are the ones who will then facilitate or conduct the classes in the various community or online.
So now when you're saying community conducting the classes or the course in the community, are you looking at a central location in the community?
Yes, we are still working with the facilitators. Right now they are telling me what facility in the community that they are proposing to use. I don't want to say yet because some of them I have to now write letters to these places of go and fill out the form to then get the permission to use the locations that some of them have indicated to me. We are getting ready to encourage people to begin registering for the courses that will be offered, and we are hoping that we can roll them out, some of them next month.
Wow, awesome. Now, is there any fee attached to the registration?
Yes, I know. Yes, the way CHIP runs is that you will have to pay for the in this case we are using a kit. So the kit will include a textbook, a workbook, and a cookbook. The person will also have access for 3 months to a meal planning program that they will be able to use during that time. And in some of the programs they have a physical education book, but in this particular package that we have, we don't have that. We have a water bottle, and we also have a pedometer, because one of the things in terms of physical activity, they promote the 10,000 step program. The fee, which is rather low, is $200 for the course. Now, people might say, well, that's a lot of money. But oftentimes in other places, sometimes many people who run this program run it as a business. Sometimes some churches might help to sponsor it and defray the cost. Or you find that some hospital might use it for patients. And what we are doing is, and some foundation might run it for the community. So that's the option we are doing, running it for the community. And by being able to run it in the manner in which we are doing it, we have like a multi-sectorial management committee, which is made up of government people, people from the Service Club, some of the NGOs. And this way, the cost, it make it more affordable. For example, I have seen in some places in the US, it's like $700 per class. But by being able to do it in this manner, we are able to then, we have a partnership with government and other agency. It make it more affordable, and so that more persons will be able to take it. And in addition to, although we have it at $200, what we have also done, we are trying to get grants, so that if a person apply to take the course and they don't say that I can't afford $200, then they will be able to apply and be eligible for a grant. Right now, the Rotary Club, the 70-20 district has donated some funds, $10,000 towards for grants for this program.
Awesome. And what's your capacity for each community?
Well, what we are doing, for example, on Anegada and Jocelyn Dyke, we are looking at 10%. On Tortola and Virgin Gorda, for the face-to-face, we are looking at 20% because of the COVID situation, and online, we wouldn't go beyond 30%.
So if you do it online and within a community, is that two separate things, or will that be?
Yes, because, for example, let's say in East End, there's a group that is over that area. So they will run a program in that community. There's a group that's working central. So we are trying to run a program central, and then we will try it west, and so Virgin Gorda, Anegada. We don't have any information on Anegada yet, but on Jocelyn Dyke. Yes.
So the online platform will be run synonymously with face-to-face, or that would either or?
Yeah.
Either or?
Yeah.
Okay. So what are expectations of the program, and how do you think it would impact persons who actually join?
Well, and that's one of the reasons to why we have been saying that I like to say that this program is for example, you hear a lot about information about health. So now you're ready to say, well, I'm really now taking my health seriously. So I would like to have a roadmap. I would like to have a guide to show me what I can do to start and maintain a healthy lifestyle. So those are the persons who this program, in terms of prevention, will be best for.
And in terms of continuity, is this a one-time program, or is this something that you expect will continue for a period of time?
Okay. Well, we have signed for the contract. It's for 2 years, and we are hoping that we are looking at the numbers to see what the results will be to determine where we go from there. However, based on the research and a lot of what we are seeing, that a lot of times that once people start to take the program, what we are hoping that those persons who take the program will become champions and be able to encourage other persons to get involved and take the program. So we are hoping that we will begin to see results. And once people begin to see the results in terms of, okay, maybe they lose weight, they're feeling better, their energies improve, their mind is clearer, and they're being able to keep those numbers in terms of cholesterol, blood sugar down, then they will be, then they will begin to feel that it was worthwhile. And I can attest from a person who have really followed a healthy lifestyle over a period of time that it's rewarding. It's rewarding to be able to, be empowered with information and education to be able to guide you why you should do this, how to do it, etc., how to mix things up. For example, I might they say 30 minutes a day for exercise. Because of over a period of time and the understanding I have, I don't have to do all one time. I can do 15 minutes. I can mix it up. The same thing with my food. I have, can pick, can choose, and so forth in terms of the importance of the sun, air, the importance of the cleaning products that I use, the products that I use in my body, toothpaste, lotion, etc. And sometimes, yes, people might say those things are expensive, but expensive compared to what? Because if I had a chronic disease, it would cost me much more.
Definitely.
So it's whether you put it on the front end or the back end. And I will say that following a healthy lifestyle work. The biggest challenge I had was with my weight. And last year, I got very intentional. Particular path. Yes, a lot of it was very much plant-based, but for 1 year, I just changed the way I ate, and the weight came off, and it has stayed off. And I have had a lot of challenge over the years with that particular risk factor. And I can say I thank God that I've been able to take off the weight, and it has stayed off so far.
Well, congratulations. We always love to hear a positive story, and to the listening audience, we hope that it serves as inspiration for persons who want to, like Ms. George, lose some weight, or have mental clarity, or lower your vulnerability to chronic diseases, or to reduce your risk factors, and basically in order to stay healthy.
Yes, because that has have been one of my theme songs from when I was in college, that I want to stay as healthy as I can for as long as I can. And so as I mature, I begin to think, well, chronic disease start to kick in the higher your age. But like I said, last year I found this book on aging without disease, and when I went through the book, I was doing, like I said, already doing most of the things that the book recommended, except that I was overweight. But when I follow, cut out the salt, cut out the sugar, the wheat, and also oil, watch my oil and increase the other things, I just saw a change.
Nice. Ms. George, final thoughts, leave our audience with a little push if this wasn't enough for them to get involved in the program, and give us some contact information.
I think I would like to encourage persons, and I want to say a special push for women in particular. And the reason why is women are the ones to me who run their household. They are the ones who shop in most cases. They are the ones who cook. And when you are empowered and can, decide how you will run your household, what food you will cook and how it should happen, and when you can give your family members a good explanation as to why you will be doing this, and then you will find that is not so difficult, because like I'm saying, with the recipes and the going for doing the exercise, the products, like I said, around the house, etc. I think that women being armed with this kind of information, it would be very helpful, because they would be able to help their children. Because as I said, the younger they start with a healthy lifestyle, the better it will be for them. And then also we find that there's a lot of men that have these chronic diseases. A lot of time I find that they end up with complication. They're on dialysis machine. Sometimes they end up with a heart attack. They will end up with amputation. So I think that women in men's life could also help them in terms of helping them to understand how, if they have the disease, how to better manage it, and if they don't have the disease, how to help prevent it. And the benefit of a healthy lifestyle to the whole family. Because like I said though, and I want to also stress, many years ago when I came into health, the persons that we saw at that time in the hospital who were presenting with chronic diseases, they were older, late 60s, 70s and on. What we have now is that what we are seeing is even in high school that there are children who are presenting with these chronic diseases. And so you have the high school age, and then that whole working population 25 to 64, which is your the people in your productive age group. And if you have a number of them being sick and they're absent from work, they have complications, etc., is a whole lot of ramifications. So I just really want to encourage us to become more intentional about our health, become more intentional about deciding I can take control of my health and I'm going to do so. And to know that by doing so, you can help to improve the quality of your life and also prevent these chronic non-communicable disease.
Awesome. I want to thank Ms. George for coming on the program today to share this vital information about the Complete Health Improvement Program that is being implemented by the Ministry of Health and Social Development. For more information, interested persons can call 468-4936, email CHIP, CHIP, Virgin Islands @gmail.com, or visit www.chiphealth.com. So if you want to boost your health, try CHIP. Together, let's press towards a healthier Virgin Islands. You've been listening to Light Vibrations, and I'm your host, Natasha Letsom, saying thank you for tuning in and blessings.
Thank you for tuning in to Light Vibration, and don't forget to tune in this time next week as we continue to bring you life-changing information. Until next time, shine your light.